Let's talk about the foods. There's 7 of them that have the potential to actually kill you.
Dr. Eric Berg, a well-known chiropractor and health educator, is recognized for his expertise in the areas of health and nutrition. He often shares valuable information about the foods we eat and their impacts on our bodies. In the video, Dr. Berg highlights 7 specific foods that pose significant health risks if not handled or prepared correctly. Each of these foods contains compounds or poses risks that can lead to serious health problems, including death in extreme cases.
So you need to know about these. So let's start at number 1, green potatoes. But guess what? If you are on keto, you're not going to be eating potatoes at all. So you're pretty much safe. But for those people who are not on keto, avoid green potatoes. When you see the green pigment,
Green potatoes contain a toxin called solanine, which is a glycoalkaloid poison. Solanine is present in all potatoes, but in very low concentrations. However, when potatoes are exposed to light, they produce more solanine, which can turn the potato green. The highest concentrations are found in the skin and the sprouts of the potato. Solanine poisoning can cause a range of symptoms, including nausea, vomiting, diarrhea, stomach cramps, headache, dizziness, and in severe cases, hallucinations, paralysis, fever, jaundice, and hypothermia. The toxicity level of solanine in green potatoes can be high enough to cause death, particularly if large quantities are consumed. To avoid solanine poisoning, it is crucial to store potatoes in a cool, dark place, away from light. If a potato has turned green, it should be discarded, as peeling the potato might not remove all the toxins. Additionally, sprouted potatoes should be avoided, as the sprouts contain high levels of solanine.
all right, number 2, nutmeg, the spice nutmeg. The compound in nutmeg that's poisonous is called myristicin. And even at 2 milligrams, you'll get a fever and a headache. At about 7.3 grams,
Nutmeg is a popular spice used in many culinary dishes for its warm, nutty flavor. However, nutmeg contains myristicin, a natural compound that, in large doses, can cause serious health problems. Myristicin can cause symptoms such as nausea, vomiting, dizziness, hallucinations, and in extreme cases, seizures and death. The psychoactive effects of myristicin are why nutmeg is sometimes misused as a recreational drug, but this is extremely dangerous. Nutmeg is safe to use in small quantities typically found in recipes. It is important to avoid consuming large amounts of nutmeg, either accidentally or intentionally. A small pinch in a recipe is generally considered safe, but consuming nutmeg by the tablespoon can be harmful. 3. Green raw almonds.
all right, now let's talk about green raw almonds, which are very bitter, as well as raw cashews. These have been known to contain a certain amount of cyanide.
Cyanide is a potent toxin that can cause serious health problems and even death. When consumed, cyanogenic glycosides in green almonds can release hydrogen cyanide in the stomach.
But the side effect from cyanide can be convulsions, respiratory failure, and death. However, with every poison, there's always an antidote. And the antidote for cyanide is called hydroxycobalamin.
Almonds sold in stores are typically processed to remove the cyanogenic glycosides. However, it is crucial to avoid eating green raw almonds. 4. Undercooked red kidney beans.
You must always soak them for at least 5 hours and then boil them. Don't put them on slow cook for at least 30 minutes. If you put them on slow cook and you don't cook it long enough, you could potentially increase the toxicity by a factor of 5 times more toxicity.
They can contain high levels of phytohemagglutinin, a toxin that can cause severe health problems. Phytohemagglutinin can cause symptoms such as nausea, vomiting, diarrhea, and abdominal pain. In severe cases, it can lead to more serious health issues. The toxin is found in many types of beans, but is particularly concentrated in red kidney beans. To eliminate the toxin, it is important to cook red kidney beans thoroughly. Soaking the beans in water for at least 5 hours, then boiling them for at least 10 minutes, can help reduce the levels of phytohemagglutinin. It is important to avoid using a slow cooker, as the low temperatures may not be sufficient to destroy the toxin. 5. Brown rice.
Now, let's talk about the next one, brown rice, which, if you're on keto, you're not going to be consuming either. But brown rice has arsenic, which can lead to heart disease and bladder cancer and many other symptoms.
Brown rice is often considered a healthy alternative to white rice due to its higher fiber content. However, brown rice can contain higher levels of arsenic, a toxic element that can cause serious health problems. Arsenic is present in the environment and can be absorbed by rice plants from the soil and water.
Apparently, brown rice has over 162 times the levels of arsenic that could be considered carcinogenic. Now, the other problem with arsenic is that they used to feed it to chickens in their feed to increase weight gain, to create food efficiency. Now, what is food efficiency? That is a situation where the chicken is so fat, it's not eating anymore. It's not hungry anymore.
To reduce arsenic exposure, it is important to rinse rice thoroughly before cooking and to cook it in a large amount of water, which can help remove some of the arsenic. It is also beneficial to vary your diet and include other grains, such as quinoa, barley, and millet, to reduce reliance on rice. 6. Undercooked bloody hamburger.
All right, I want to talk about uncooked bloody hamburger. I'm sorry, I know that's disgusting, but here's the problem. If you're buying a low quality meat from your local grocery store, you could be exposed to E. coli. And there's a very toxic form of E. coli called verotoxigenic E. coli.
E. coli infection can cause symptoms such as severe stomach cramps, diarrhea, often bloody, vomiting, and fever. In severe cases, it can lead to hemolytic uremic syndrome, HUS, a condition that can cause kidney failure and death. To prevent E. coli infection, it is crucial to cook hamburgers to a safe internal temperature of 160 degrees Fahrenheit 71 degrees Celsius. Using a meat thermometer can help ensure that the meat is cooked thoroughly and safely. Additionally, it is important to practice good kitchen hygiene, such as washing hands and surfaces after handling raw meat. 7. Cherry pits.
All right, the next one is cherry pits. Okay. Cherry pits have hydrogen cyanide. Now, I know you're probably saying, I don't consume cherry pits, right? I just consume the cherry. And of course, if you're on keto, you're not even eating cherries. But just in case you end up swallowing a few, they are a bit toxic.
Cherry pits, along with the pits of other stone fruits such as apricots, peaches, and plums, contain amygdalin, a compound that can release cyanide when metabolized. When chewed or crushed, cherry pits can release cyanide, which can cause symptoms such as headache, dizziness, confusion, nausea, vomiting, rapid breathing, and increased heart rate. In high enough doses, cyanide can cause respiratory failure and death. It is important to avoid chewing or swallowing cherry pits. If you accidentally swallow a whole pit, it will likely pass through your digestive system without causing harm, as the hard outer shell prevents the release of cyanide. However, it is best to be cautious and remove pits before consuming cherries or using them in recipes. While many of these foods are commonly consumed and can be part of a healthy diet, it is important to be aware of the potential dangers they pose if not handled or prepared properly. Dr. Eric Berg's revelation about these 7 foods serves as a valuable reminder to take food safety seriously and to be mindful of how we prepare and consume our meals. By following safe handling practices and being informed about the risks, we can enjoy a healthy diet without exposing ourselves to unnecessary dangers. Thank you for following us this far in the video. If you have any questions, leave your comment. To learn more about your health, subscribe to the channel and turn on notifications.